In this video today, I will talk to you about whether you are at risk for developing esophageal cancer. If you wait till the very end of the video, I will tell you exactly what you need to watch out for to make sure your risk is virtually none. So those guys who are joining me today, my name is Dr. Samir Islam, and yes, I am a poop doctor. I want you to think of me as your poop guru. And my passion is to give you tips and tricks to help out with your gut health. If you're new to this video series, I do a lot of videos on gut health, medical health, and patient educational videos such as this one. At any point in time during the video, click on the show notes down below. We'll give you more information about what I'm going to talk about in the video today. But in today's video, I will talk to you, are you at risk for developing esophageal cancer? Now, this video was inspired from a recent celebrity who died recently, Eddie Money, who was one of the greatest, or I think, one of the greatest artists that were out there. I grew up listening to him, and he recently died from esophageal cancer. And I want to tell you about some of the warning signs that you're going to have to worry about when it comes to esophageal cancer. So, what exactly is esophageal cancer? In essence, there's two main types. There's what's called adenocarcinoma, then there's what's called squamous cell carcinoma. The most common cancer currently in the United States, the one that's rising a lot more frequently, is what's called adenocarcinoma, or cancer of the esophagus, from usually chronic acid reflux or chronic heartburn. Now, a lot of people who have acid reflux don't develop cancer, so I don't want you to feel like that just because you have acid reflux, automatically you are going to develop cancer. But we do know for those patients who do develop what's called esophageal adenocarcinoma, the most common reason, more than anything else that's out there, more than anything you can think of, is chronic acid reflux. Let me know in the comments down below, have you suffered from chronic acid reflux, or do you know somebody who unfortunately has been diagnosed with esophageal cancer, and do they have acid reflux as one of their symptoms? Now, 10 to 50% of the people who have acid reflux will develop cancer, which means about 90% will not. But we want to make sure that you are not one of those 10 to 15% who may develop cancer of the esophagus. Now, the reason people get cancer is that chronic acid reflux over time can cause damage in the lining of the esophagus, and that damage over time can lead to a condition called Barrett's esophagus. Now, Barrett's esophagus is a precancerous lesion of the esophagus that, if it's left untreated, has a potential to lead to esophageal cancer or cancer of the esophagus. Now, I won't talk into more detail about what Barrett's esophagus is, but let me know in the comments if this is a video you want me to talk about. But in essence, there's three main types. There's Barrett's esophagus without cancer cells, there's Barrett's esophagus with some cancer cells, then there's Barrett's esophagus with a lot of cancer cells. But irregardless of what type that you have, this does put you at a higher risk of developing cancer of the esophagus, because cancer of the esophagus, specifically adenocarcinoma, does come from Barrett's esophagus. Now, over time, these changes can lead to more and more changes inside the esophagus, which eventually those cells will mutate, and that mutation will lead to cancer of the esophagus. And we can see this actually when we do a scope. When I go down with an upper endoscopy or an EGD, we can see cells that look consistent with Barrett's esophagus. And we can tell right then and there if you have this condition or not. In order for us to diagnose you with this condition, we actually have to take physical biopsies of the esophagus to let us know what type of Barrett's esophagus you may have. Now, the important thing that I tell a lot of patients, the important thing I want you to know, is that the frequency and the severity of your reflux symptoms does not correlate to your risk of developing esophageal cancer. What I mean by that, I have people who come to see me who have rip-roaring reflux. They have reflux every day, it's not controlled, or it's barely controlled with their medications. The severity of the symptoms does not correlate to your risk for developing esophageal cancer. In fact, a lot of people who have esophageal cancer actually may be having intermittent or kind of the occasional acid reflux, and it may not be acid reflux on a consistent basis. And that's the scary thing when it comes to esophageal cancer. I can't tell you that you are at risk for developing cancer based on your symptoms of acid reflux alone. Unfortunately, the only way we can know this is to make sure you don't have the precancerous cells inside the esophagus called Barrett's esophagus. So, who are the people who are most at risk for developing esophageal cancer? Caucasians. We know that Caucasians, especially male Caucasians, tend to be the ones that are the prototypical patient to develop Barrett's esophagus and esophageal cancer. We know that being obese or having fat around the belly does make you more likely to develop worsening acid reflux, but also worsening chances of developing esophageal cancer. Chronic acid reflux is a risk factor, but that reflux typically is intermittent. It's not all the time. It's not a chronic symptoms for a lot of my patients. They may be having just intermittent symptoms in which they have the occasional acid reflux, in which they need the occasional medications to control their symptoms and make sure they don't have any particular problems from this. So, here's what you need to know about when you need to worry about whether you are at risk for developing cancer. Are you one of those people who has intermittent reflux? Maybe you're a male who's overweight and you're wondering if you have reflux, or maybe you're a female as well and you have acid reflux and you're wondering, hey, do I need to worry about acid reflux? Do I need to worry about what's going on? Am I personally at risk for developing cancer of the esophagus? If you're worried or you want to know, comment down below. But here are the signs that I worry about, or when I listen to my patients, these are the things that I want to cue in on or hone in on to see if they have a chance for developing esophageal cancer. The first thing are age over greater than 55. If you're having worsening symptoms or new onset acid reflux and you're over the age of 55, you may need to be investigated about whether you may have precancerous lesions or having problems inside the esophagus. Number two is if you have anemia, black stools, or bloody stools. This is never normal. If your blood count is low and we don't understand why, if you're anemic, we don't understand why, or if you're having bleeding, this is a time for us to investigate exactly what's going on. This is another alarm symptom that's there. If you get full quickly, you're not eating as much, you just don't have as good of an appetite, or you're just not eating as much as you used to, could be a sign that something could be going on inside the esophagus, in which we need to do further investigation to see exactly what could be going on. If you have a lot of nausea and vomiting, you don't understand why, or this is a new symptom that you're having, this could be a sign of something going on inside the stomach or the esophagus, which could be something we need to investigate. If you have a lot of weight loss and it's unintentional, especially if it's unintentional, this is never a normal thing to have. And make sure you speak to your healthcare provider about whether you need to be investigated for this or whether you need to have further investigation of what's going on inside the esophagus or what's going on inside the stomach. And if you have difficulty swallowing, things are getting stuck, you have food getting stuck, or things are going down very, very slowly, you're choking on food, or it hurts to swallow, this is not normal. I can't stress this enough. I don't understand why people think it's normal to have food getting stuck. I don't understand why people think it's normal to hurt whenever it swallows. This is never normal. That does mean something's going on. And we need to do further investigation to find out exactly what is going on and potentially treat what is going on as well. So in summary, chronic acid reflux or heartburn is a risk factor for developing esophageal cancer. And that risk factor is called Barrett's esophagus, which is a precancerous lesion of the esophagus. And this can lead to cancer over time depending on what type of Barrett's esophagus that you may have. My question for you guys is, what questions do you have about cancer of the esophagus? Is there something you want to know? Are there questions you want to have? Is there more information you want to know about what's going on with Barrett's esophagus? Comment down below. I'd love to hear what you guys have to say and let me know what you guys think. I want to thank you guys for watching this video. Don't forget to click the like button. Follow me on all my social media pages. And every Tuesday I do my Facebook Live, and every Thursday I do my Poop Tip Thursday, where I drop the deuces on exactly what questions you may have. But thank you guys for watching today. I look forward to seeing you guys on more videos, and have a great day. Thanks and take care. I want to thank you guys for watching this video today. If you want to hear more about reflux and what to do about that, click on these videos. If you want more videos on gut health, click on these videos as well. Esophageal adenocarcinoma. Drop them deuces!